just like to introduce the people in front of you.
Yeah.
I'll start with Ashley Chari. He's the General Manager or Country Manager for Philips Philippines. Mr. David San Pedro, he's the General Manager for Reliance Care. And of course, Didrik. Didrik Steven is the General Manager for Asia and Pacific. Maybe just to start, we could have David to present or give us some background or overview about Reliance.
Okay, good morning everyone. Sorry for keeping you waiting. We had a bit of just to get Clinton and Didrik to get to know each other. But my name is David San Pedro. I'm the General Manager for Reliance Care Inc. Reliance Care is the outpatient health services arm of Unilab. So we take care of all outpatient services, which means anything which is 23 hours and 59 minutes I do in my shop. We have multi-specialty clinics, we have dialysis centers, we have surgical centers. We also run the largest network of corporate clinics. We are very pleased to have with us today Didrik, Ashwin, and the rest of the Philips team to actually signify our intent to work together very closely as we grow the Reliance network of clinic services. So you'll see a lot of very exciting things in 2019. I think Paula has put together a short video for us, but I'm happy to share with you beyond what has been given in the press briefing, what our plans are for the Philippines. Thank you, Paula. Sorry, yeah, so that's our new building. That's what's coming up, I think 3 blocks from here. It's called the Williams, what do we call it? Williams Center. 6 stories, of which 3 are dedicated to outpatient services. But you see a lot of new treatments come out from the Williams building. We start operations this quarter, 4th quarter, with the first group of people moving in. And then by Q1 2019, you'll see one of our first partnerships with Asian Eye for a high volume cataract center come out in Q1 2019. So it'll be the highest volume in the country. Yep, and Philips, we're working with them right now currently on our multi-specialty clinics. So they are providing us medical equipment for that on a preferred basis. And then on our cardiac center, so we're going to do some cardiac services, some really fancy cardiac services. And it will also be with Philips. Okay. And finally, a new and emerging area, which is sleep study. So Philips is one of the leaders in the world, or you're the leader in the world in sleep. So we are partnering with Philips for our sleep business also. So a lot of different aspects that affect, I guess, healthcare. Our focus is really chronic disease, and it's something which I think having Philips as a partner on is something very important to us. Thank you, Paul.
Thank you very much, David. Now, maybe calling Mr. Didrik to share his views about Philips.
Yeah, so I don't have the cool music that you guys have. I will just do the talking.
Okay.
But maybe first and foremost, with the point of our collaboration, I think we concluded with you 75 years in healthcare, and our company, in fact, over 125 years of existence. Yeah, we're bringing 200 years of healthcare experience
Yes.
actually to the market together.
Yes.
And I think that is the key word, together in the form of a partnership, which I believe is in fact critical to address the growing needs in healthcare in the Philippines. And yeah, I think the working in partnership is absolutely critical. You cannot do that as a company alone. You need to find partners that are complementary to you, and then team up and provide better care in a holistic way. Our company, if you actually go back to that first slide, our company is changing. I think many of you probably will know Philips as a company that used to be active in audio and video and television and radio cassettes and what have you. Over the past decades, we moved away from a big part of the consumer electronics to a company that's wholly focused on health technology. And health technology in the broadest sense of the word, so not only equipment in the household, but also equipment in hospital and equipment between the house and the hospital and all the underlying technology there. So our products actually change into solutions, and we are really looking across what we call the continuum of care. Very much also what Unilab is actually projecting across the continuum of care to improve the lives of people. Living healthier, by healthy living in the house, a focus on prevention. Preventing diseases is always still the best thing actually that can happen to you when you prevent something from happening. Diagnosis, very much first time right diagnosis, allowing the doctor to come to the right decision when a certain situation occurs, and deciding on the right treatment. And I think that's an area where a lot of improvement is required. And then especially if you get elderly, to provide a certain amount of home care. And that on the basis of a continuum of care, not only for the people itself, from cradle to grave basically, but also connected with the relevant health informatics, where your health data, especially in the future, will be in a cloud, and you will manage those data yourself and allow care professionals or people in your care team access to it. Go to the next slide. That seamless providing of care is a requirement also, so we need to simplify it, because one of the key things what you see in healthcare in many countries, it's very, very expensive. So we need to remove excess cost. We need to provide care on an outcome basis. We need to improve our treatments, and we need to drive outcomes in our care model, and taking out the excess cost, simplifying insights and data, and giving patients and in fact staff, which is critical, we just talked about that, a better experience. Needless to say that a patient that has a good experience will come back for its care needs. The patient that has a good experience in having the right treatment and fast recovery will recommend others for that specific experience. And we want to have our patients basically get the best experience they are entitled to. And we do that amongst others by also very much focusing on the experience of staff. Staff in the clinics, staff utilizing Philips technologies in providing care. To to capture the equation, what do we need to do in care? We actually need to innovate. And innovations are actually coming in many ways nowadays. Your phone is loaded with innovations. Think about the time 15 years ago, and I think all of us were already around 15 years ago, when we did not have those phones, and where we are nowadays. That's a lot of innovation. But that phone is actually also a data center that in the future will gather a lot of possibly your health data if you allow it to do so. So you have innovation technologically. Think about your phone being part of your care system. You have clinical innovation, faster, better healthcare procedures when it comes, for example, to cardiovascular care. You have social innovation. Your care is not only provided by your doctor or a nurse anymore, but possibly your neighbors or your family are part of your care team, and they help you manage your specific illness. And last but not least, business model innovation. And that brings us then to this last slide, where we talk about partnerships. And we come to the conclusion that long-term strategic partnerships are an absolute requirement to actually answer the challenges that our customers and their customers, most of the times patients, are facing in today's society. And that's why we're here today, to really underline and emphasize the importance of such a partnership, and therefore I'm actually very happy to be here. Ding, 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 ding. Huh? Very good.
Now we have the signing of the partnership.